let's talk about indications for C-section, or why your doctor might recommend a C-section. There's really two big categories of C-sections. There's what we call a scheduled C-section and an emergency C-section. A scheduled C-section is a C-section where you and your doctor decide before you go into labor that you're going to deliver the baby by C-section. And then you're scheduled for surgery, just like any other surgery. You come in before you're in labor and the C-section is performed. An emergency C-section is any C-section where that's not true. Maybe you're coming in, you come in labor, you're expecting to deliver vaginally, and for some reason you're not able to, and you have to have a C-section. Or it's a chance that you're having a scheduled C-section, but for some reason you have to have an emergency C-section before that scheduled date. So those are sort of the two big categories. So let's talk about reasons for elective or scheduled C-sections. The most common one is that you've had a C-section before. And so most communities now in the United States, women that have had a previous C-section are going to deliver by a scheduled C-section in their subsequent pregnancies. And we're going to talk about that because it's a little bit controversial in another video. The other reason that people have scheduled C-sections, the other big reason is what's called fetal malpresentation. In other words, the baby has to come down head first to safely deliver the baby normally through the birth canal and vaginally. If the baby is breech, meaning the butt's coming down first or the legs are coming down first, or transverse, meaning it's coming down on its side, then it's not safe to try to deliver vaginally. And for that reason, you'd need to have a C-section. So that's another very common reason. Another common reason is multiples. Now, some people will do vaginal deliveries for twins, but anything higher than that, absolutely need a C-section. And most of us now are recommending C-sections for our patients with twins as well. So those are some of the reasons why you might have a scheduled C-section. There's other reasons as well, certain health conditions that may exist that might make it either dangerous or impossible to deliver vaginally. There is a trend that some women are having elective primary C-sections for no reason whatsoever except that they want to have a C-section. Most of us are a little uncomfortable with this, although our governing bodies basically say that if a woman absolutely insists on a C-section for no good reason, that we should let her do that. Well, I agree with that in principle. However, I'm going to try and talk you out of it because honestly, it's generally a lot safer for you and it's better for the baby and it's better in general if you can deliver vaginally. But if you need a C-section is safe and it can be life-saving for you and the baby. Now, let's look at the other category, emergency C-sections. Emergency C-sections can be for lots of reasons. Maybe you come in labor and they find out the baby's breech, and you would need a C-section at that time. Maybe you have a scheduled C-section, but you go into labor, so the C-section has to be done before that scheduled date. But how about the woman that comes in and is planning on delivering vaginally and something changes? So one of the things that we're doing is we're watching the fetal monitor and make sure that the baby's health is okay. And we have a kind of general idea how much longer it's going to take before you deliver. And if we start seeing signs that the baby's stressed and we know that delivery is a long way off, we might at that point recommend a C-section because we don't want the baby to get damaged during the labor process. So one of the big reasons that we do C-sections is what we call fetal intolerance to labor. The baby's not doing well and you're not about to deliver. The other big category is used to be called cephalopelvic disproportion, which means the head's too big for the pelvis. Some people call it failure to progress. In other words, you're not dilating, or the other term is arrest of descent and dilatation. Basically what it means is either you're not dilating or you've pushed for a long time and you can't get the baby out. So if labor is no longer progressing, even though you're in good labor, we know something's wrong. Maybe the baby's too big for your pelvis, maybe your pelvis is too small for the baby, or maybe just the way the head's positioned as it's coming through, it's not fitting right. But for some reason or another, the baby's not coming. And at some point, we need to recognize that and say, you know what, vaginal delivery is not going to happen. We're going to need to do a C-section. And that would be a reason as well to do a cesarean section.